Good morning, students. Here we will discuss the topic which we have started in last time: role of pharmacist in interdepartmental communication and community health education. Means how pharmacist can educate the community or your general public, so to increase their quality of health. In that we have come across with the several points up to last slide. This point we have discussed, in which up to the role of pharmacist in educating the patients or the public regarding the HIV, their transmission, tuberculosis and diphtheria. Today we will go for the 12th point: quit smoking of medicines. Here, students, I would like to highlight this point because number of peoples are suffering from this habit. It becomes the addiction when any person is going to take the cigarettes or any other type of nicotine, chewing tobacco or any sort of that nicotine is inhaling, so it becomes habit, and it is very, very difficult to come out from that condition. For that, lots of things the physicians or the consultants are doing. It for that they also need their family help. Otherwise, it is very difficult because they are taking this for last so many years. So for that, there are various steps of preparations which has been used for this. It includes nicotine patch. Now actually what we are doing and how we are going to be eradicate that habit of smoking. So the what that cigarette contain, it contains nicotine, and what it contains, it also contains nicotine. So what we are doing, we are slowly we are decreasing the blood level of nicotine. Means we are giving the dose of nicotine in small quantity, and we are not directly decreasing their habits. We are decreasing the dose of nicotine slowly day by day, and we are we are replacing the smoking nicotine which they are getting by the smoke. We are replacing them with the help of these nicotine patches. After that, nicotine gums, lozenges, inhalers, nicotine nasal spray. There are certain transdermal patches are also available. So by this way, we are giving them nicotine, and there are certain drugs which are released by control release. For example, this bupropion, it is antidepressant drug. It's antidepressant drug which can be given for sustained release formulation. Means slowly it releases in our body, and whatever depression which occurs by leaving that cigarettes, so that depression can be relieved by giving these drugs, bupropion. And along with them, we must have some psychotherapy and drugs. By combining both, we can easily eradicate these smoking habits. So we should learn how to quit smoking and also educate the general public or the civilization how to quit this smoking. Now next point is woman and infant care. Nowadays we becomes very carey regarding the woman and their pregnancy and the infant care. But earlier there are very less facilities are available, and also lack of education is there, lack of knowledge is there, due to which we are not doing proper guidance to the woman to do all the things regarding her all three trimesters. Here, the important point is hygiene. We must maintain the complete hygiene during that period. And prophylaxis of disease means we should able to avoid the various diseases which occurs during pregnancy. For example, obesity may occur. After that, depression may occur. After that, nausea, vomiting, GIT problems. After that, lots of psychological problems also occurs. So we are able to remove or we are able to eradicate them by giving some therapy or by maintaining our diet or our lifestyle, our daily habits. Again, vaccination and immunization, proper child care, proper child education. In that, right nutrition plays a great role into our pregnancy. Slowly reduces sugar and salt, because sugar and salt are nothing but the poison in our diet. In case of pregnancy especially, we should try to remove them, reduce them slowly. Replace defined refined carbs, carbohydrates with complex carbs. Means we have to replace these refined carbs with the help of these complex carbs, for example oatmeal, brown rice, and the refined carbs we have to replace them. They are not easily digestible. These oatmeal and brown rice are easily digestible, and they are helpful for our body. Check labels and opt for sugar free or no added sugar products. We should go for the sugar free products, because diabetes condition also may be developed. So for avoiding them, we should go for the sugar free products. Don't replace fat with carbs. Whole fat yogurt with low fat version. We should never do that, because fats will also increase the obesity. They will also increase the chance of cardiac arrest. Atherosclerosis can be developed. So for avoiding this, we cannot directly replace the fat with them by replacing with carbohydrates. Because in early days, the lots of people were thinking that if we'll increase the intake of fats, lipids into our diet, so it is helpful for the pregnant lady. But it becomes myth. It is only traditional way, but it is not the fact. Because if we'll increase the ghee or oil into our diet, what will happen? It will increase our obesity, it will increase our atherosclerosity problem, it will increase our lipid level, triglyceride level into our blood, and it is very hectic for that typical pregnant lady. So we must do them balance that. Next point is eat breakfast regularly. That is very important, because number of times we are skipping breakfast. We are in a hurry, we don't have time to take breakfast, so we cannot do that. We should take, especially in case of pregnancy, she must take breakfast early in the morning at 8 o'clock or 9 o'clock before starting her day. So that is very important, and regularly she must take that. Boost energy with quality proteins, low risk of obesity, osteoporosis, and diabetes. So that's why the lots of gynecologists are giving the protein supplement along with the diet to this pregnant lady to increase their protein level into the blood. And we should take the good fat and avoid the bad fat. What is good fat and bad fat? Good fat are nothing but the HDL. It is high density lipoproteins. And what are the bad fats? They are the LDL, VLDL. LDL, it is low density lipoproteins, and VLDL, very low density lipoproteins. What are the examples of good fats? The examples are nothing but the omega fatty acids. After that, the fats which contains unsaturated fats. And what are the examples of LDL? Especially the oils, the ghee, after that the animal fats, after that the fats which contains in eggs. These are nothing but the unsaturated fatty acids. They are the saturated fatty acids, and HDL contains the unsaturated fatty acids. So that's why we must go for the unsaturated fatty acids, which contains high level of HDL. We should try to avoid these saturated fatty acids. Now, mono unsaturated fats are found in foods such as olive oil, avocados, nuts like almonds, hazelnuts, and pecans, and seeds such as pumpkin, sesame. So we must include all these nuts and these fruits into our diet to increase their food value. Polyunsaturated fats includes omega-3 fatty acids found in fish like salmon fish, herring, mackerel, anchovies, and sardines. So these are the various types of fishes which contain the omega-3 fatty acids. Also the oil like olive oil, they also contain these omega-3 fatty acids. We must include this into our food. Other sources includes flaxseed and walnuts. Walnuts contain a maximum quantity of omega-3 fatty acids. So we must include walnuts into our diet. Take vitamin D3, calcium and magnesium. So our food also contains the vitamin D3, calcium, which will help the development of bones of the kids. And also vitamin D3 help them into development of their bones and also avoid the osteoporosis, also strongness of the teeth and all our body developments. There should not be any scarcity in their body. That's why we should include magnesium also, calcium, after that potassium, next is copper. Like this, various elements, trace elements are also important in the diet of pregnant lady. Vaccines types. Now here we will discuss regarding the vaccines. First of all, what is vaccines? Vaccines are nothing but the live or killed agents which can be given to the kids which will fight against the viruses or bacteria which we can invade us. So before invading, if you are giving this, so they will fight because they will produce the antibody against the typical virus or bacteria. So these are called vaccines. There are various types of vaccines that we will come across one by one. One is inactivated vaccines. Inactivated but previously virulent. Earlier they was having the viral load, but now they are inactivated microorganisms that have been destroyed with chemicals, heat, radiation and antibiotics. The examples are influenza vaccines, cholera, bubonic plague, polio. What is bubonic plague? Now you know, in 16th and 17th centuries, plague had taken more than 300 million population of the world. Means almost one third population has been affected with this plague, and it can be carried by the flea through some animals like rat or any flea can also directly by its sting it can transfer that typical bacteria. That name is Yersinia pestis. That pestis was the bacteria which was responsible for invasion of that plague. Polio, poliomyelitis, hepatitis A and rabies. So these are the examples of these inactivated vaccines. Attenuated vaccines, these are live or attenuated, means their effect has been suppressed. Their virulent property has been suppressed. So attenuated microorganisms, active viruses that have been cultivated under the condition that disable their virulent properties, or they use closely related but less dangerous organisms. Now the examples of these attenuated vaccines are yellow fever. So this yellow fever is also called as the virus flavivirus. And in this yellow fever condition, our eyes, sclera and skin becomes yellow. Why it become yellow? Due to the development of jaundice. It becomes jaundice, and also there is problem into the respiration, and person can die. After that, measles, rubella, it is also a virus, mumps, and the bacterial disease typhoid. So for this also the vaccines has been developed. Toxoid vaccines are made from the inactivated toxic compounds that causes illness. In that, tetanus, and diphtheria. Tetanus is one of the virus is specially affects on our nervous system. It badly affects on our nervous system, and not only nervous system but also it affects on our lymph nodes. There is enlargement of lymph nodes. It becomes the shape like egg, and it is very difficult to walk, and due to which also it affects on our respiratory system. It suppresses the respiratory system due to which person cannot able to breathe properly. And diphtheria is also one of the virus which causes problem into our respiratory system, which affects on our nose, after that throat, and at the back of our throat it produces the hardness, and due to which the person is not able to take proper breath. And it is also one of the problematic condition in case of, especially in case of kids, it occurs in the infants. Next is protein subunit. What is protein subunits? These are the proteins which has been especially identified from the viruses, and these specific proteins which don't have any virulent property, they don't have any viral property, and they are identified, they are taken from the specific part of the virus. These proteins are taken and they are utilized, and it is also one of the example of the vaccines which can be used to avoid the various and this type of proteins now it is under the discovery. It can be used, or it is under the process of discovery of HIV virus, because still till date, no any vaccine has been produced for Ebola virus and also for HIV virus, and coronavirus is also going on. But especially for HIV and these Ebola virus, it is very difficult to prepare a vaccine, because these viruses are changing their structures. So out of them, which one is non-virulent protein that has been identified, and that sample has been taken to produce the vaccine. Now here we will discuss the vaccination program, which occurs especially in kids from 0 to 6 years. Now where, at which time, which vaccine we have to give, this is the perfect program which you should also know, and you should educate all the peoples of our country. So when you have to take which type of vaccine, it is very complete planned program. Now we will start from the first vaccine, hepatitis B. There are various types of hepatitis A, B, C, D, E. Hepatitis B. We should give this vaccine starting at the beginning of the birth. After that, at first and second month, and after that, from 6 month to 18 month, and from the 18th month, this green color indicates that from the 18th month the immunity has to be developed, means immunity has been developed after 18 month. If you are giving these doses, or especially two doses from 1 to 2 month and 6 to 18 month, in divided doses you can give. Next is rotavirus. Rotavirus is one of the virus which occurs in below the age of 5 years. It occurs almost all types of kids. Means even I, you also, at least one time in a life, below 5 years, we may have diarrhea due to this rotavirus, and it is also life threatening if we won't give that vaccine. But once you got that infection, after that you may develop the immunity. For this we can give, now government also included this vaccine from last 2 3 years into their planning, into their, like polio virus, this vaccine also has been included. Now if you go into the private market, it will cost near about 1000 to, or near 1000 rupees. Now this rotavirus you should give at the beginning of second month up to 6 months. You cannot. It is specially developed up to 6 months, because if you will give up to 6 months, it don't have any use. It won't show its effects. That's why try to keep in your mind, and also teach all the people regarding rotavirus that you must give it before 6 months. Next is diphtheria, tetanus, and pertussis. Tetanus we have discussed. Pertussis, it is occurs to the Podentella pertussis, and it develop to the kids, especially infants and the kids which are up to the age of 3 4 years. And in this condition, the whoop like whistling sound occurs during respiration. That's why it is called as whooping cough. And for a whooping cough, this Bordetella pertussis is one of the bacteria which is responsible for the typical condition. And it is also one of the life-threatening condition. And more than 1,000 1,000 peoples in 1 year they were suffering right now. But earlier, more than 10,000 kids was suffering all over the India just few years back. For this also, you can give this vaccine at the beginning of second month, fourth month, and sixth month, and again you can give in 15th month and at the fourth year. So in this fashion, you can plan these vaccines. Next is Haemophilus influenza. This also you can give in second month, after that 6 month and 12th month. From this period, the immunity can be developed. After this period, there is no need to give this vaccine. Same likewise, pneumococcal vaccine you should give from second month. Next is inactivated poliovirus. Now poliovirus eradication program is going on in India from last so many years, and till date, from last 2 3 years, we didn't find any person or any kids who is suffering from this poliomyelitis. Now we can assure that the polio has been completely eradicated from the India. Still, we have to control this program because nobody knows from where it will come. Because it is still there in Bangladesh and Pakistan and Myanmar and Dhaka and all these places. Influenza, it can be given from the 6 months and up to the 2 3 years. Likewise, regarding measles, mumps, rubella, varicella zoster, after that, hepatitis A, meningococcal. This meningococcal is one of the bacteria which can be produced into us, and there is one vaccine is available which we can take after the 2 3 years, but it is producing the high risk in high risk groups. So in this fashion, we have discussed the whole planning of this vaccination program. Now here, what we should discuss here, that is red patches. These all red patches they are available means no any vaccine is available for these typical microorganisms. Here is hepatitis C, no any vaccine. HIV, Ebola virus, cytomegalovirus. This is the one of the virus is a type of herpes virus, and for this also there is no any vaccines available. Again, RSV, it is a respiratory syncytial virus, and malaria. And this yellow includes partially effective vaccines are available for influenza and tuberculosis. Still, tuberculosis is there in India. Lots of patients are suffering from this. They are under treatment. And measles, hepatitis, rubella, rotavirus, mumps, yellow fever, tetanus, diphtheria. These all contains. These all are having the vaccination, and they are having good results. Pneumococcus, whooping cough, and hepatitis A. So in this fashion, we must know how many vaccines are available and which vaccine we can give to our kids, so that we can prevent. Prophylaxis is very important. We can prevent them from the various infections. Nowadays, if you will see, lots of kids are has been come out from the danger, because earlier the mortality rate below 5 years was high. Nowadays it has been declined, means whatever number of kids are born, so their life percentage or their reluctance rate is high right now. Why it is high? Because we are protecting their life by giving them by various vaccines, because vaccines are giving them shield, they giving them guard to protect their life from these various viruses. Now, 14th point, prevention and management of drug abuse, misuse, and addiction. There are various types of drugs which can be used for drug habituation. It can be used for the euphoria purpose, for the well-being purpose. The drugs like drug stimulant, methamphetamine or amphetamine. These are the stimulant drugs. Anabolic steroids, the drugs which we are using for our bodybuilding, body development. So they are nothing but the anabolic steroids. They may contain, they are the analogs of testosterone or androgens are available or non-androgens are available. If you are taking these drugs for longer period, they becomes addicted. Person will be addicted for these drugs. LSD, lysergic acid, diethylamine, from so many years, from the ancient period, these drugs have been used as a habituation. Cocaine, you know already, cocaine, heroin, marijuana. What is marijuana? Marijuana is nothing but the synonym for cannabis, and in Hindi we can call it as a ganja. And this drug can be used for euphoria, but it can be produce the relaxing effect, but it can be produce again lack of short-term memory and relaxation and increased diet. Person becomes very lethargy and sleep rate will be increased. So like these various problems can be arise, uh, and disorientation also will be produced by this marijuana. Prescribed drugs, it includes the drugs like diazepam, alprazolam, lorazepam, zolpidem, valproic acid, paroxetine, amitriptyline, carbamazepine. These are the various drugs which can be used for the treatment of various psychological disorders like anxiety, like depression, like psychosis, like stress disorders. For the various purpose, these drugs has been used. They are affecting on the various receptors like GABA receptor, 5-HT receptor, dopamine receptor, noradrenaline receptor. When we are taking these drugs without prescription, or though we are taking under prescription, if you are becoming habitual to these drugs, so we are taking this for longer period, and definitely they are affecting on our neuronal level. They are increasing or decreasing. They are producing imbalance between our neuronal level, biochemical level, and for which it induces a problem. It induces the habituation, and if we stop, they will produce the withdrawal symptoms. So that's why we cannot stop. We will stop, the person becomes very irritable and very excited, and very difficult, sweating will be there, restlessness will be there, because the person becomes very aggressive also. That's why it is very difficult to come out from this. Again, there are treatment and drugs and psychotherapy. Rehabilitation centers are available. Very good rehabilitation centers available at Bangalore, where if I saw there, lots of patients are come out from these conditions, and now they are becomes very healthy life. If and nobody knows, out of 100, near about 5 to 10% people are suffering from the psychological disorders, but they are not taking medicine or they are not treating them, because they are thinking that it is their normal behavior, or it is their normal attention, but that's not the matter. They should consult the psychiatric or neurological consultant, because problem is there. So we should take the drugs and try to work on our problems, and we can come out from that typical conditions. Otherwise it can increase the crime in the society. It is a very problematic conditions. Fifth is alcohol use awareness programs, alcohol advice and harm reduction services. This society also uh, badly affected with this alcohol addiction. lots of people have already lose their life, and lots of people have developed the various critical conditions, critical diseases like cancer, due to the regular or chronic uptake of alcohol. They become addicted. They won't take food. They won't talk with their family or family members, but they will take alcohol from the morning till the night. At any time, they will ask for this. So it becomes habitual, it becomes addiction, and it is very difficult to completely come out from these conditions. So we should run some programs to teach people, to educate them, and you should make aware people regarding the bad habits or regarding the bad effects, bad pharmacological effects of this alcohol on our body. So supervised administration of methadone, synthetic opioid, it is used medically as a pain medication and maintenance therapy in people with opioid dependence and other subunits. In case of alcohol, disulfiram tablets are also available if you are giving with daily food intake, and also psychotherapy. If you will think I have to leave this alcohol, definitely you will leave that. And if you won't think, if any other person forcefully tried to eradicate your alcoholism, so it is very difficult. So by our our own, we should think that we have to come out from this critical condition. Then it is possible. Otherwise, it is just impossible. It will take your life if you won't stop. Clinical pharmacy, patient care. Here also the role of pharmacist. What is clinical pharmacy? We can teach patients how it is going on in the society, in the hospitals, in the various clinical setups, CROs, and in general community pharmacy. How can we take the patient's care? Individualization of the drug therapy means for each person the typical drugs need to be prescribed, means we cannot give the ABC drug for all. According to the patient, according to their history, according to their genes, we should prescribe the drugs according to their sensitivity, which antibiotic or which drug is suitable for their body, suitable for their typical genes, we should give the drugs. Monitoring of drug utilization and pharmacovigilance. Once the therapy has been started, there is role of pharmacists to monitor the patients whether the drugs are producing right effect or not. The therapy is going on in right direction or not. If any adverse effect is going on, drug interaction is going on, so he should notice that. He should check the patient. He should come in touch with the patient for any negative or positive effects. Nutrition counseling is very very important. No any drug will cure patient without the nutrition. Suppose if you are having very good type of therapy, but if you are not taking proper nutrition, in case of tuberculosis, if you are not taking proper diet, proper balanced diet, proper healthy diet, you cannot come out from the condition. You cannot recover from the tuberculosis. We have done some survey in nearby our area. It is a fact people are not taking their food at proper quantity or proper quality. That's why there is very importance of nutrition. Suppose out of if your nutrition, if any factor is opposing or if doing any food interaction with our drug, it is also very problematic. So we must know that in that typical condition, which food we should not take and which food we should take. If it is opposing your therapy, we should stop that typical food and replace that with another. Health screening. What is health screening? We must educate all the peoples of the society to do the routine checkup at least once in a year regarding the blood sugar, regarding the hemoglobin, regarding the our blood calcium level, regarding our thyroid. So like this bilirubin, HOT, GPT. So all these things means all the organs starting from our heart to our blood vessels to our liver to our uh, kidney. to our GID. So all this and our thyroid. So we had to get the knowledge of our body. What are the aspects on which we can work? If we know the complete knowledge of our body, then and then we are able to diagnose that problems. If you are routinely checking your body, definitely no any problem will occur. Family planning. We must educate all the society what is the importance of family planning, because our India is cruising ahead towards the highest population in the world, because after China it took us only few months. After few months we will cross China. For that, we must tell the importance of family planning to all the peoples from all the religion, all the caste, all the layer of peoples. So, how can we increase the family planning devices, their use, how why you should use, what is the importance of that, how can we give the quality education to our to our peoples, to our kids, if they are in less numbers in family, if there are eight numbers, how can we teach, how can we give good education to all, how can we fulfill their requirements if there are in large number of family in our home. So that's why family planning is very very important. Documentation and research, whatever things are going on regarding the health, we should immediately do the documentation regarding the adverse effects or regarding any new therapy which has been invented. So for that we should do the documentation. Counseling and advising the public on treatment of minor ailments. For a small things we should concern with the peoples, and we should teach them, advising patients of any adverse side effects of medicines or potential interactions with other medicines and treatments. If any adverse effects may occur or is going to occur, we should discuss with the patients and treat and teach them. Preparing dosette and cassette boxes, usually for the elderly, but also for those with memory or learning difficulties. It is very, very important. You should prepare the typical box. Also, there should be three compartments, means for the morning, for the uh, afternoon, and for the evening or at the night. So we should prepare, and also give them typical color for typical compartments. Boxes should be there, and timing should, you can write there at which time you should take. So typical things you should prepare, typically for the people who are old age, in which dementia may be developed, or the people who are having losing memories problem, memory loss, or they are having short term memory problem. So in that condition, in normal also you can prepare this. It is very easy to find out the drugs and to take the drugs, where tablets are placed in the compartment for specific days for the weeks. Undertaking medicine use reviews and advanced service to help patients understanding how their medicines work and why they have to take them. Means what is the role of which medicine, you must tell to the patients why you should taking that tablets, in which condition you should stop, you should take these tablets. Suppose if patient is will have fever, in that condition you should take the paracetamol. If there is no fever, don't take paracetamol. Like this you can recommend to the patients. In case of gastric problem, if bloating is there, if direct condition is there, you should take that metronidazole, otherwise don't take that metronidazole. In that condition you should give them, you should suggest them regarding the therapy, which drug is for what, and when you will switch on the button and when you have to switch off the button regarding that typical drug. Monitoring blood pressure, BMR, and cholesterol levels. You should always monitor the blood pressure, check your blood pressure, and report them. You should offering and diabetes screening services. Diabetes also may be produced, so you should check the blood sugar level and maintain the awareness into the people to check their blood sugar level. If it is in early stages, the person can uh, stop to take increase amount of sugar, and they will increase their lifestyle in such a way that they don't have the diabetes in future. Arranging the delivery of prescription of medicine in patients, managing, supervising and training pharmacy support staff. It is very important. Should manage all the staffs. Budgeting and financial management. We should plan our finance in such a way that how you will help them for the society, and how you will plan for educating all the people, keeping up to date with current pharmacy practice, new drugs and their uses. Is how new drugs has been developed. Make aware regarding that new drug into the people, so people can learn their importance, and they can get their information from the pharmacist. So thanks a lot, students, for hearing me carefully. I hope you understood the whole concepts. If you have any queries, you can ask me. Okay, so goodbye for today. We will see the next topic in next lecture.